Cases of COVID-19 have been remaining steady for yet another day, going down on St. Croix. According to the latest numbers from the VI Department of Health, there are currently 264 active COVID cases territory-wide, with 155 on St. Croix, 97 on St. Thomas, and 12 on St. John. And our healthcare workers have been through some of the toughest times with this pandemic. And on top of everything, our hospitals have experienced problems with staffing shortages. As we have reported, the Juan Louis Hospital in St. Croix has had to ask for outside help with its staffing with its ICU. Our USVI News Washington, D.C. correspondent Rachel Knapp tells us what Congress is trying to do to solve the problem.
Healthcare has been navigating through a lot of challenges.
Senators say the pandemic helped create shortages in almost every industry, including healthcare, impacting local hospitals and medical centers.
Healthcare workers have handled long hours, overcrowded facilities, fighting a deadly new virus.
AHN St. Vincent's Hospital's chief medical officer told us back in October they've struggled with staffing issues. And back then, a third of their nursing staff were travel nurses who work short-term positions at hospitals and clinics all across the U.S. And years down the road, doctors worry the crisis will get worse.
Primary care is in a crisis, as you've already alluded, between burnouts, early retirement, an aging workforce, and competition with other medical specialties. As Senator Hickenlooper said, we're headed for a predicted shortage of almost 130,000 physicians by 2030.
And that's not all. Senators say, according to the Association of American Medical Colleges, we'll also need to hire at least 200,000 nurses over the next 5 years to meet the increased need.
If we're going to make a dent in these daunting estimates, we need to get started now.
Senators are taking a hard look at how to retain and train people to meet the healthcare workforce demand. Some suggest improving workforce conditions to prevent burnout. Others suggest encouraging kids at a younger age to pursue a career in healthcare could be a start.
We got to make sure we're at least coming up with some good ideas and not necessarily just spending money on the problem.
But some say additional funds could help, especially in building a more diverse workforce.
We need to double the Pell Grant, embracing the only national program that helps low-income students achieve higher education would serve the nation and ease the path to needed professions.
Some members say vaccine mandates also pose a threat to the workforce shortage. However, the data about how many have quit because of the vaccine requirements in the healthcare industry is unclear at this point. However, back in December, the CDC said more than 77% of healthcare workers are vaccinated.